My name is Judith Abbott from Vision 2020 Australia, and I have the pleasure of welcoming you to this session. I did just want to start by recognising the traditional owners of the land on which we are meeting today, the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging, and any elders who might be with us today. So this is a bit of a pleasure to chair this session because KeepSight is a program that really features a genuine partnership across the diabetes and eye sectors, across a range of academic, technology, clinical and other players. And so partnership is really at the hub of it, as is trying to design a program that reflects and works for people living with diabetes. And so before you today, you see a panel that very much reflects that commitment to partnership. And we're going to be hearing from a range of speakers talking about various aspects of the program. It is a national program that's only really just kicked off this year, so it's a fairly new thing, and it came after quite a lot of work recognising that if you're a person living with diabetes, likelihood is at some point in time you may well manifest signs of diabetes in your eyes. And so we know with that if we can intervene early, if people can be seen, that we can actually stop them potentially losing sight associated with diabetes. And that's really what's brought us all together for KeepSight. It's a partnership between Diabetes Australia, Vision 2020, the federal government, Centre for Eye Research Australia, Ocular, Specsavers and many others. And today we're going to start with a presentation from Professor Greg Johnson, who I'm sure will be known to everyone at this conference rather well. As CEO of Diabetes Australia, his responsibilities are broad around leading work that improves lives for people living with diabetes, working with health professionals and researchers dedicated to diabetes, and many others involved in the chronic disease space. He's led a number of coalitions and really important organisations and partnerships that have led to real change in this country in terms of how diabetes is managed. He's also CEO of the Diabetes Australia Research Limited and is an honorary professor of the Faculty of Health at Deakin University. So with all of that as background to Greg, I'm going to get him to start and kick off our panel discussion today.
Thanks, Judith. Get this thing going. So, Judith's given a nice introduction there, and I thought I'd just give you a little bit of background to KeepSight, and Judith's nicely outlined the fact that this is an important partnership, as I say, it's bringing the eye sector and the diabetes sector together to combine our efforts. As you know, diabetes is the fastest growing condition in Australia. Another 105,000 people have been diagnosed and registered to the National Diabetes Services Scheme in just the past 12 months, and there's now over 1.3 million people registered to the National Diabetes Services Scheme. So the NDSS is a key element of KeepSight and what you're going to hear about today. As you will all know, all people with diabetes are at risk of vision loss and blindness. We know though that 98% of this is preventable with good diabetes management, of course, or optimal diabetes management and early detection and treatment. But we do know that about 50% of people with diabetes in Australia don't get their eyes checked according to recommended guidelines. And as you all know, those guidelines have been around for a long time, NH and MRC endorsed guidelines, but about half of all people. So based on the number currently registered, that's over 600,000 people in this country with diabetes who know they've got diabetes who are not getting their eyes checked according to those guidelines. So the advocacy journey for KeepSight commenced really back in 2013 when Diabetes Australia launched an election platform at the time and said we need a national diabetes strategy. One of the key elements of that call back in 2013 that led to the current national diabetes strategy was we need national complications prevention screening programs. And the national diabetes strategy recognises that might be individual complication screening or multiple complication screening, but that's what we need. In 2014, we teamed up with the eye sector through Vision 2020 Australia and Professor Peter van Wingarden is here today, who you'll hear from, and others, and put together a joint advocacy document we call it the National Diabetes Blindness Prevention Program, and we started advocating for such a national complication screening. As I said, the National Diabetes Strategy was then released in 2015. In 2017, we still hadn't got there, but we continued to advocate. We then moved on a little bit more, and one of the key triggers for that was broadening the alliance of interest, and in particular two key bits. One was that Specsavers came on board as a corporate partner and offered $1 million a year and challenged the federal government to match that. Said, well, let's have a public-private partnership and match this funding. And the other thing was that we became increasingly aware that we had another, in addition to the NDSS database as a great asset in a program like this, we had another great asset, which was a system called Ocular and a sharing of information across the eye sector that had been built over a number of years, and you're going to hear from Alex on the panel who will tell you about Ocular. So it was really about realising that we had this enormous opportunity to link these existing platforms in a powerful way. And that captured ministerial attention, and then last year, fortunately, the government announced through Minister Hunt initial funding of $1 million to match the Specsavers $1 million. And then earlier this year, just in fact a few weeks ago in National Diabetes Week, we had confirmation of further funding of another $1.5 million for year 2, and we have a commitment from Minister Hunt and the government that they'll look to a sustainable funding for this program, because importantly, this is not a project that's going to just be done and dusted. It's an ongoing complications prevention screening initiative, and it needs to go for the next 20 years. And we'll see powerful outcomes. So this slide sort of shows the principal elements of this, and at a funding level, we've been calling for this 5-year initial funding commitment with a combination of half that funding from the private sector and public. As I said, Specsavers coming to the party with this private-public partnership proposal. And, the great thing about this has been just how united our views have been with Vision 2020 Australia, with Optometry Australia as a part of Vision 20, well, not a part, but a key player, the Royal Australian College of Ophthalmologists, and lots of others, and other corporate partners now wanting to be part of this. So I think we've, built an enormous common interest here with lots of people who want to be part of it. So our key objective is to activate, through marketing and messaging, 630,000 people with diabetes to better understand their risk. They're the people who aren't getting their eyes checked. The problem is we don't know who those people are at the moment. We know that about over 600,000 people are either not having eye checks, diabetes eye checks at all, or they're not having them as frequently as required. But we don't know who those people are. So through this program we will find out, and we will build a system that enables us to be able to report against that over time. This, of course, is what the growing background looks like, that the registration to the National Diabetes Services Scheme continues to grow, and as I said before, we've hit the 1.3 million mark, and the run rate over the past few years has been well over 100,000 people per year, over 105,000 in the last 12 months. This just gives you a sense of what consumers say about reminders from Diabetes Australia, and this is important because what we're going to do here is issue reminders to regularly in different ways to people with diabetes around their risk. But a key thing here is Diabetes Australia, when consumers hear from Diabetes Australia, they see that as coming from an organisation that speaks with authority, that it's diabetes to diabetes. It adds trust to the process from the optometrist. So often people may be getting messages, information from the eye sector, from optometrists, but this adds trust to that process. So it works with regular reminders and more information about how to manage their diabetes and how to manage their risk. So we'll utilise the NDSS register, and I should say that this has been a long-standing call from the diabetes sector, and people like Paul Zimmet, Professor Paul Zimmet and others for a long, long time have been saying the National Diabetes Services Scheme database is a national asset and we should be using it more as a health registry and doing things with it rather than just an administrative database. And this is the first program where we've finally got that imprimatur from government. That's an amazing point in time, really, because the NDSS has been building as a database for over 30 years, but now to start seeing the NDSS as a much more active tool in improving the health of people with diabetes through programs like this. There'll be opportunity for us to target different audience segments at different times: type 1 diabetes, type 2 diabetes, newly diagnosed, people who have had diabetes for more than 10 years, younger people, older people, metro, rural, the opportunities there to target messages at different points in time. And of course, link that targeted messaging to the local service delivery framework that's important. And that's where partnering with Vision 2020 Australia and Optometry Australia and the eye sector is so important. So I'll finish there and hand over to Peter van Wijngaarden. Just closing comment is that we have, one of the powerful things here was to point out to the Minister and to government, and we did this over a number of years, that other countries have implemented systematic diabetes eye screening programs in different ways. There's no perfect model here. The UK, Iceland, many other countries, and with great results. And if you look in Australia, diabetes continues to be the leading cause of vision loss and blindness in working age Australians. It shouldn't be so. It's not that way in the United Kingdom anymore because the UK established a diabetes eye screening program over a decade ago. And so that gives us a very clear signal about what's possible here, is to knock diabetes off the perch. It shouldn't be the leading cause of vision loss and blindness in working age Australians. And over the next 10 years, we're looking forward to making that happen. Thank you, Peter.
I think we could all agree that knocking diabetes off the perch is a very, very good goal to aim for, indeed. Our next speaker is Associate Professor Peter van Wijngaarden, who's a Principal Investigator at the Centre for Eye Research Australia and is also part of the faculty in ophthalmology at the University of Melbourne Department of Surgery. Critical to mention that while there was a single slide there that summarised the trajectory to get to this point, you have before you two of the people who demonstrated what I'd call advocacy resilience by advocating repeatedly over a really, really long time to get this program off the ground. I was the person that arrived a week before the documents were sent, but Greg and Peter between them have been absolutely instrumental in getting this thing happening. Peter has not only done a medical degree and completed his fellowship in ophthalmology, but he's also done a PhD in retinal vascular biology. So he knows what it's like to see people who have permanently lost vision due to diabetes, and is very actively involved in the profession across a wide range of areas. So we're going to get Peter to talk about the UK experience and what it's teaching us in Australia.
Thanks, Judith, and thanks everyone for attending. I think the resilience story is very apt. I think we had 31 versions of the proposal to government before we finally had success. So it has been a long journey, but it has been a shared journey, and from the start, it's been instrumental that we have cross-sector representation. And again, from the very first meeting that Greg and I had, this is all about the patients. And the reason that is so pertinent is really summarised quite dramatically in those photographs up there. Those are photographs of two patients with end-stage diabetic retinopathy, and unfortunately that's a reality that I see as a clinician in a public eye clinic every week. Patients coming to my clinic Often for the first time they've seen anyone for their eyes with end-stage eye disease, and this is happening in Australia. I had the fortune of working in the UK for a couple of years while I was doing a postdoctoral fellowship, and I worked in the public hospital eye clinic, and I did not see cases like this that I see on a weekly basis. So that was a really strong incentive for me to try and make a difference, because it's not good enough for us to see patients at this time when most of this is avoidable and preventable. Not easily so, but it is possible. So we know that diabetic retinopathy is very common. We've just recently conducted a national eye health survey where we went to 30 sites around Australia and sampled people over the age of 50. And we found that of those with self-reported diabetes, 1 in 3 had diabetic retinopathy to some extent. And it was sight-threatening in about 6% of non-Indigenous Australians. Unfortunately, the statistics are, as is the case for most diabetes complications, far worse in the Indigenous community. Rates of vision-threatening diabetic retinopathy are more than double. So if we think about the Australian population, we know that there are around about 70 to 80,000 Australians currently with one of the most common sight-threatening complications of the disease, which is macular edema, swelling in the area that's responsible for central vision, that interferes with daily function, driving, reading, recognising faces, and that is sight-threatening in 3 out of every 5 of those people. So you just need to cast your mind to the MCG. A pretty capacity crowd is the number of people we're talking about at a national level. It's a large number. And of course, we know that the risk of these complications increases with duration of disease, if there's been suboptimal control of risk factors, and we know that there are high-risk groups. We've already mentioned Indigenous Australians, communities that are culturally and linguistically diverse, and also high-risk periods of life, so people with pre-existing diabetes or women with pre-existing diabetes during pregnancy. But on the bright side, there are excellent treatments, and there are clear understandings that if we control risk factors from early on, we can dramatically change the trajectory. And we can see there that association, which is now very, very old from the DCCT, that shows that the risk just increases exponentially with HbA1c levels. But we have great treatment, so there is hope, and we can do better. But we know that there are challenges. There is, of course, as Greg alluded to, that massive challenge of scale of the problem. You know, there are millions of Australians, or at least 1.5 million Australians, who need to have regular eye checks, and that poses a system challenge. Around the world, the number is staggering, around 400 million people. And of course, it's not easy to have diabetes in modern day life. It's quite a hostile world with marketing and big food and so on. And of course, we're all tremendously busy in our daily lives. So even for someone without diabetes, it's hard just managing all of the daily life. But then if you have to think about your diabetes over 100 times a day and make decisions in relation to that, it's easy to imagine that it's easy for some of those risk factors to fall out of optimal ranges. So it's tough. And of course, our patients are being bombarded with different health messages, often conflicting about different organ systems, different risks, and it's very easy to be inundated by that. One of the main problems with diabetic retinopathy is it's often asymptomatic until it's at an advanced stage. And so it's very easy to worry about it later. If you're not bothered by your vision, it's very easy to just think about it later. And of course, engaging in regular screening involves behaviour change. Behaviour change for people with diabetes, but also our clinicians, our GPs who are seeing our patients. It's very easy for this just to be put into the too hard basket or left to the eye people. And with modern medicine, actually the eye has kind of fallen out of primary care. GPs no longer, in general, feel comfortable examining the eye for fear of missing other sight-threatening complications. And so we see this fragmentation, and that leads to poorer outcomes for people with diabetes. So there is really strong evidence, as Greg mentioned, that we can do a lot better. So in the UK in 2003, they started rolling out a national program to screen for diabetic retinopathy. They didn't have a remarkable asset like the NDSS registry. Every general practitioner had to submit lists of the patients in their clinic with diagnosed diabetes. They were then contacted phoned and asked to turn up for eye exams. They had photographs of the back of the eye, which were then sent to reading centres, of which there are now 87 different reading centres across the UK. Those expert graders would look at those photos, grade the degree of retinal disease, and then refer patients on for management as needed. And within a decade of the introduction of this program, diabetes was no longer the leading cause of blindness registration for working age Britons. First time that had ever occurred in the 50 years that records have been kept. It fell from top position to number 3. So striking evidence in a reasonably short space of time that these programs can make a difference. So we've got all the ingredients of success in Australia. Arguably, we have one of the world's best trained eye healthcare workforces. We have an excellent workforce of diabetes clinicians. We have subsidised eye examinations for all people with diabetes. We have this unique treasure that is the NDSS registry. We have unparalleled access globally to the very best medicines to treat established retinopathy. And we have a government that's very interested in investing in digital health. So it shouldn't be a problem. But as Greg also mentioned, only half of Australians with diagnosed diabetes are currently engaged in care. And that's largely because there's no system. There are gaps in this network. So what should be not a problem at all is a problem due to fragmentation, and people are falling between the gaps. So KeepSight seeks to address this. It's a reasonably simple concept. We will seek to engage people with diagnosed diabetes to attend an eye health practitioner. If they have an established relationship, they're invited to go and see their existing eye care provider. If they do not, there's an easy way via the website application to find an optometrist near them. They attend for an eye examination, and their eye practitioner registers that attendance, logs it, so that can be linked back to their NDSS record so that it's a cross-check. We know then who's engaged in eye care so that we can target resources to the people who are missing out. At the moment, we have no idea who is engaged and who is not. And the value proposition for people with diabetes is that they get another reminder. They get someone else looking out for them so that when life is hectic and they forget to turn up for their eye exams, there's someone else just saying, have a think about getting an eye check. We have a website, so there's a freely available portal, the keepsight.org.au, where patients, or people with diabetes rather, can sign themselves up, or clinicians can sign people with diabetes up to participate in the scheme. There's also a communication portal called Ocular, which is a leading communication portal between optometrists and ophthalmologists, and there's a streamlined workflow there, and Alex is going to talk to us about the importance of that for the success of the program. So we've been live with KeepSight since early this year in April, and we have been having a fairly graded or gradual introduction of the program. We've done very targeted marketing, direct consumer messaging and mass media campaigns in select areas, and we're testing the impact of those strategies. So we've had 3 focus regions, Southeast Queensland, Southeast Melbourne and Western Sydney, and we're testing different strategies to communicate to people with diabetes in each of those areas, and we've got some very useful insights on what seems to be working best. The stages ahead are really around increasing those communications, mobilising larger numbers of people with diabetes, and that's going to start soon. Once the program's rolling, we want to be some more sophisticated and targeted in our messaging, because very clearly the population with diabetes is a diverse representation of the Australian population, and so all ages, all different motivators and drivers, and so we now are seeking to really tailor that engagement communication to develop messages that are relevant to different sectors of the population. Of course, the funders of the program are expecting measurable outcomes, and that's the government, but also Specsavers, Bayer, Mylan, Novartis. All of our funders are seeking to see evidence of traction. And in the short term, that's going to be things like registrations, because that's easy to measure, but then attendances, recall, successive recall, All of these things are going to shape improvement in eye health. We saw in the UK, where it was a very systematic rollout, that it takes about 10 years for this to really impact blindness rates. Unfortunately, we don't have a blindness registry in Australia, so that's another thing that we're going to be advocating for, but we need to measure the impact of our program. So here's just a bit of a montage of some of the early marketing material that's gone out. We've had highway billboards. We even have had signs at the local urinal. I'm yet to see one of those. We've had electronic messaging in GP practices, conventional media, social media, and the like. And we're seeing that we are starting to get some traction. So here is a recent sort of map of where the registrations are. You'll note that those pie charts show the numbers of registrants. The blue sectors of those charts are people who've been registered by health professionals. What we know from the traffic on our website is that many tens of thousands of people are visiting the website. There's interest in the program, but most people with diabetes are waiting for the endorsement of their trusted healthcare professionals before they sign up. And so that's why it's critical that healthcare providers, GPs, diabetes educators, all of these trusted professionals are advocating for KeepSight. So with that, I will hand it back to Judith, and I think Alex is next. Thank you.
So technology plays a really critical part in this program, and Ocular has been an important partner in getting the program off the ground. Alex Gears is here to talk to us about that aspect of the program, and his role at Ocular is quite wide and spans a range of things, but he's got a background that's quite diverse. We're having a chat beforehand, and he was talking to me about how he'd come out of large corporates and working in the digital space, and then he randomly mentioned he did establish a private health fund a few years ago. So you've got a very kind of man of the world before you here who's bringing quite a wide range of perspectives to thinking about the KeepSight program. And fundamentally, what he was saying to me, what drives him is wanting to have the right information in the right place at the right time, which I think is something that unites all of us. So Alex, thank you.
Right, so we've seen what the entry point is to KeepSight, where patients can self-register and also where practitioners can, register themselves. However, the front end of a website or any portal is only the start of the challenge. So for the KeepSight initiative to be successful, there are two key things that we needed to look at and address. And the first part is, to Peter's point, we have world-class health systems, optometrists, ophthalmologists, and also are blessed with something called the NDSS. However, what we find in a lot of healthcare systems that there is no loop connecting a lot of this. And essentially there is nothing to connect the puzzle that is essentially healthcare. And the second part is, what we're looking at doing is essentially implementing change. And implementing change in any industry is exceptionally difficult, and probably even more difficult in the healthcare industry. So those are the two things that we had to try and address. One is, how do we fix the puzzle, and how do we not interrupt workflow? And this is where Ocular is such a wonderful system. It was founded in 2015 with the Centre for Eye Research, and in 2016 was launched. Ocular is a cloud-based platform that connects clinicians around the patient. To date, we've got about 80% of all the registered ophthalmologists using the platform, and about 2/3 of all the referrals that currently happen in the optometry space go through the Ocular platform. To date, there's also been about 750,000 patients registered, or patients' records go through the system. When we launched in New Zealand in 2018, and within a very short space of time, had about 50% of all the referrals that were flowing through in New Zealand. And in a couple of months, we hope to launch in the US and also the UK. and basically demonstrating that we're addressing a problem that is essentially a global issue of being able to connect patient care across many different systems. So what drives this level of uptake and this success is part of the first part is we always keep the patient at the centre of whatever it is that happens. So the patient is central to absolutely everything. The second part is understanding how difficult it is to change people's workflows, is we work extremely closely with clinicians so that we understand how they work and we minimise the disruptions that they have. And then the third part is addressing the technology part of it is we integrate with as many people as we possibly can. The first integration that was done with a company called Optimate, and that is predominantly used by independent buyer groups and other corporates. And then secondly is we integrated with Specsavers, given that they are such a huge player in the market. So by doing this, we actually ensure that the benefits accrue to everybody in the system, and that the information is provided to the right person at the right time. So as much as Ocular is a web-based platform and can be used as a standalone, the important part is that because we integrate with everyone and to look at how do we make KeepSight as successful as we possibly can, we've integrated KeepSight into the Ocular communication channels that we have. And to Peter's point about how they have experimented with various different marketing programs to try and get traction, you can see that once the workflows are streamlined for clinicians, that the uptake is significant. We are currently sitting at around about 1,500 new registrations per week, which clearly puts us, I think, on target for being able to achieve the 50,000 that we would like to see by the end of the year. And to Peter's point as well, there's a number of different ways that you can help make the initiative a great success. And then we've left you with a couple of points here to consider and take away. Thank you.
And our last but by no means least member of our panel today, who tells me that she's not being rude, she's just live tweeting as we go, is Renza, who I understand is very well known across the diabetes sector. I had the pleasure of chairing a panel that Renza was involved in at one of the largest optometry conferences a couple of months ago, and I spent some hours afterwards having optometrists come up to me and tell me in various ways how they thought they'd like to be Renza when they grow up, or quote some of the key numbers that she presented in the roughly 2 minutes she spoke. So I took from that she's a very impactful and influential human being, but I'm also going to give you a little bit of an insight into what she does as her day job. So as National Program Manager for Type 1 Diabetes and Consumer Voice in Diabetes Australia, she very much lives this space and very much helps shape the thinking about how we best do this. She's also stream lead for the Living with Diabetes stream at the IDF World Diabetes Congress to be held in South Korea later this year, and is also pretty influential in the diabetes online community, I understand. So author of one of Australia's most widely read patient blogs, which I cannot pronounce accurately, so I'm not going to try. Renza can help me with that after the session. So I'm going to invite Renza to kind of wrap up our formal part of presentation before we shift to a bit of a Q&A session.
Thank you so much, and I'm going to be super quick because I think actually it'd be great if we could have a good discussion. One of the biggest frustrations about living with diabetes, and you will hear this frequently from people with diabetes, is that we are so sick of talking about numbers. We're sick of being graded by our A1C or, you know, what's your blood pressure, what's your weight, and also all those sorts of things. So it's with great irony that I'm starting my talk with a number, and that number is 121. And I love this number, and I throw it around quite a lot because this is the number of diabetes-related decisions a person with diabetes has to make every single day. So that's on top of the decisions about what we want to eat for breakfast, because it's what we feel like eating for breakfast rather than what our blood sugar is doing at that particular time of day. Will I wear these boots or those boots? What colour skirt will I wear? All of those decisions that everybody else has to make, we get to make an extra 121 of them that are just diabetes related. There is a lot going on in our heads. This is by a woman in the States who is a cartoonist, a designer. Her name's Haiti Merritt. She has type 1 and she drew this, which was just to represent exactly what is going on in the head of a person with diabetes at any one time. There is a lot happening there. So the reason that I love KeepSight, and I think it is such a great thing, is because it's this. It's the first step towards a diabetes PA. So I have a job. I work at Diabetes Australia, and I am also a mum. I've got a very beautiful 14, nearly 15-year-old daughter. I am a wife. My partner is a jazz musician, so I love going and hearing him play. I'm a friend of wonderful other, got great friends. I've got a really, really busy life. But I have another full-time job, and that other full-time job is living with type 1 diabetes. I've been doing this now for just over 21 years. And I would really love somebody to do some of the admin for me. That admin stuff is boring. Diabetes is boring to begin with, but all the other admin stuff on top of it is really boring. And part of that is making sure that we remember things like, have we had our screening done? Have we had that done? And so to think that we now have a recall and reminder system that is taking one of those tasks away from us is actually a huge help. And that's why I'm just such a huge fan of this. I'm also a huge fan of KeepSight because it is literally a 2-minute registration. I keep saying that to people. Have you registered yet? Find 2 minutes or I'll do it for you right now. It takes no time at all. And with that, it's just one of those things that's going to actually help us need to do one less thing to living with diabetes. There's actually nothing bad about this. I kind of, have thought, okay, what's the negative side to KeepSight? And I really, honestly can't see anything. I'm just hopeful that, down the track, we're going to have that diabetes PA being able to do a lot more for us than this, but this is such a brilliant first step. So as health professionals, I would really encourage you to tell the message of why KeepSight is actually just one of those things that's going to help make life easier. And I don't know anybody living with type 1 diabetes who wouldn't want that. So that's all from me. I'm going to go sit down.
Thanks, Renza.